On the Health Watch this morning, I want to talk about a number of topics, including, of course, monkeypox, how it's being addressed here in Connecticut. With us once again, happy to have Dr. Syed Hussain from Trinity Health of New England. Usually we're talking about COVID. Right now, certainly just from a numbers perspective, monkeypox a lot smaller of a threat at 35 confirmed cases. By no means what we're seeing with COVID, but this is a concern. Where do we stand with efforts to try to contain it in vaccination?
Sure. So, morning, and thank you for having me, Tim.
Yes.
So the risk for the general population remains low. Now, having said that, it's important for folks to understand what the symptoms are and what you can do to prevent monkeypox disease. So symptoms include flu-like symptoms, and which then progress to could be a very debilitating, painful rash with fluid, pus-filled blisters that scab over. It can take up to 3 weeks from exposure to onset of symptoms, although we typically see symptoms that start within 2 weeks of exposure. If you are an individual who's come into contact with somebody who's suspected or has confirmed monkeypox, then you are eligible for the vaccine, and you should go to the Connecticut Department of Public Health website for monkeypox vaccine to see eligibility, as well as making an appointment so that you can prevent this disease. You can take get the vaccine up to 4 days post-exposure to prevent onset of symptoms.
And that's important to remember. It's not too late if you feel like you've been exposed. That vaccine will still help. That being said, at last check, I believe the state has 800 doses. Is that at this point any cause for concern, or are we expecting that number to ramp up?
Short answer is we need more. We need the federal government to assist us in getting more vaccine. Right now it's only 800, as you can imagine, is a very tiny number. And the at-risk population is whom the Connecticut Department of Public Health is targeting right now, the highest risk individuals. Again, if you feel like you might fall in that category, please go to the Connecticut Department of Public Health website. You need to make an appointment to get the vaccine. But it's really important we ramp up our public health apparatus and get more vaccine available so that we can prevent further spread.
Okay, let's talk about back to school. It's obviously a little early, 4 to 5, in some cases even 6 weeks before we're going back. But any sort of safety precautions, anything health-wise that parents should be starting to think about now?
First and foremost, like I always say, it's get your child up to date with vaccination. That's the most important tool in our toolbox right now as children start getting ready to go back to school. Second thing is also look at the community transmission level where you live. CDC has a low, medium, and high-risk community transmission level, which will help determine what additional precautions you need to take, such as indoor masking, if there's high community transmission of COVID-19. So schools will work on what the CDC guidelines are to ensure a safe environment for children.
I know you talked about this. You were on the Fox 61 News on Sunday talking about now rebound cases of COVID, because we saw Dr. Anthony Fauci get a rebound case after taking Paxlovid. Now the president also has had one. What do we know about the occurrence of these, why it seems to happen as well?
So no doubt these are high-profile cases, but what I want viewers to keep note is that this is a very effective drug in preventing severe outcomes. Yes, a small percentage of patients may develop rebound COVID-19, for which you may need 5 days of isolation. Symptoms can be mild, or you may remain asymptomatic and just test positive. The why behind this is still not known clearly. It may be linked to the virus not being fully suppressed by the medication. It does not mean that the drug isn't working. It just means the virus isn't all eradicated yet within the body, and so it bounces back. Again, very small percentage of cases we're seeing. And if you do happen to be one of those cases, you need to isolate for 5 days and wear a mask for 10 days.
I'm also guessing it might be slightly more likely to happen just because of the demographics of the population who would normally be taking Paxlovid being at risk. Maybe their immune systems aren't quite as robust anyway.
That's right. And we're dealing with a more transmissible variant now, BA.5, that is gaining ground in this country.
Okay. Well, Dr. Hussain, thank you so much for taking the time to join us again today. We'll be back next week, hopefully with a bunch of new topics, because there are never a lack of topics to talk about with you. So thank you,
for
joining us again today, Doctor.
Thank you.